Next talk is by Dr. Susan Philip. Madam is Associate Professor R.A. Trivandrum. She will be speaking on viral glaucomas. Over to you, ma'am.
A warm good morning to one and all. And at the outset, let me thank Dr. Papa for giving me this opportunity, and we are very happy to have a keynote speaker with us. So my topic for today is how glaucoma is associated in viral diseases. So let me first present it to you a patient who has come to us, a 28-year-old male patient who is a painter by profession, came to our clinic with a history of conjunctivitis 3 months ago, which was treated elsewhere. His present complaint was a dull ache in both eyes with blurry vision. His eyes were white, but he had multiple subepithelial opacities in both corneas, and his vision was 6/6 blurred in both eyes. Intraocular pressure was 28 millimeters of mercury in right eye and 30 in left eye. Cup disc ratio was normal. He gave history of using lotiprennol eye drops for subepithelial opacities for the last 2.5 months. His intraocular pressure returned to 12 and 14 after we stopped lotiprennol, and initially he was treated with anti-glaucoma medication. So steroid drops were the villain here, as he may be a steroid responder. So when you treat a case of subepithelial opacities due to adenoviral infection, monitor the intraocular pressure and use steroid drops judiciously. But in acute adenoviral infection, if the intraocular pressure is high, you must suspect an associated trabeculitis and will need judicious use of topical steroid drops, close monitoring of intraocular pressure, and if it is elevated, it must be controlled with anti-glaucoma medications. So what is the relevance of this topic? When Papa gave me this topic, I was wondering what to say. The ocular manifestations and sequelae of viral infections are not well understood. In fact, the association of viruses with glaucoma is considered relatively uncommon, in part due to underreporting and due to lack of long-term follow-up studies. So recent literature on emerging viral infection, especially in Zika virus and our COVID virus, has shown association of glaucoma with ocular viral infections. Renewed research activity in this, especially in endemic regions, is the need of the hour. So I have listed a few common viruses which are associated with pathogenesis of glaucoma. And how does the virus enter? It either through the direct entry, or it can be from the systemic circulation by the breach in the blood-retinal barrier. So as we know, the viral infections can cause glaucoma either due to trabeculitis, inflammation of the trabecular meshwork, or by the infiltration of the inflammatory immune cells like polymorphonuclear leukocytes, etc. in the trabecular meshwork or Schlemm's canal, or by release of pro-inflammatory cytokines, enzymes, reactive oxygen species, leading to glaucomatous changes. So viral uveitis can either present as an acute onset, as in herpes simplex virus. It can be chronic, as in rubella virus, or both acute and chronic is seen in cytomegalovirus infection. Cytomegalovirus infection and Ebola virus infection can cause posterior segment pathology, mainly in immunocompromised individuals, which can also cause secondary glaucoma. So herpes viruses are the commonest, which produces are the commonest viral infections, and those are the ones which causes glaucoma commonly. And in that group, we have herpes simplex virus, varicella zoster virus, and cytomegalovirus. Usually, herpes viruses, almost all of us will be having herpes, can have herpes simplex virus in our body, and those who have had chickenpox definitely has varicella zoster. So glaucoma is the commonest complication of herpes virus ocular infection. So herpes simplex 1 is more commonly associated with glaucoma. Following primary infection, HSV establishes a latent infection in the trigeminal ganglion or the sensory nerve ganglion, reaches the neural axons, causing inflammation and diseases in the periocular, corneal, and intraocular areas. The existing literature and clinical presentation establish a strong link between HSV infection as a significant cause of anterior chamber uveitis and consequent development of uveitic glaucoma. Varicella zoster virus, unlike HSV uveitis, has an acute recurrent cause. Typical facial lesions, vesicles, rashes are seen, and varicella zoster almost always manifest unilaterally. Cytomegalovirus is commonly seen in immunodeficient individuals, as in HIV patients, and it causes trabeculitis ocular hypertension, while in in acute cases, and in chronic cases, increased intraocular pressure is due to restricted aqueous outflow through damaged trabecular meshwork following chronic inflammation. I don't know whether you can see the pigmented KPs are seen in the periphery, and the second picture, if you see, you can see typical coin-shaped KPs in the center, which is typical of cytomegalovirus. Cytomegalovirus can also cause glaucoma in immunocompetent patients also, because it may present as a recurrent acute or chronic inflammation, and Posner-Schlossman syndrome and Fuchs heterochromic iridocyclitis, as in many literature, it has been reported as patients had cytomegalovirus, their aqueous tab was taken, and cytomegalovirus has been isolated from that. So Toga virus causing glaucoma includes chikungunya and rubella virus. Chikungunya we have had many episodes of chikungunya in Kerala. So in few cases have been reported with uveitis following chikungunya virus. Rubella virus typically presents with congenital rubella syndrome, which has many associations along with congenital glaucoma. Rubella commonly affects the younger age group, and it induces glaucoma, is associated with dysgenesis of the anterior chamber angle. In addition, inflammatory components, early extraction of cataracts, and necrosis of ciliary body and trabecular meshwork are the other contributing factors for rubella-induced glaucoma. Filoviruses causing glaucoma includes Ebola virus. We have not much literature in India about that. Ebola virus induced uveitis was either bilateral, anterior, or pan-uveitis. Cases of glaucoma, cataract with glaucoma, and corneal scar with glaucoma were seen among those with Ebola virus disease. These are the flaviviruses causing glaucoma: dengue, West Nile virus, hepatitis virus, and Zika virus. Dengue virus induced ocular complications include paracentral scotoma, blurred vision, retinitis, etc. But anterior uveitis and glaucoma also has been reported. Despite the paucity of reports, dengue virus induced uveitic glaucoma is a potential, because it's a potential virus agent with ocular tropism. That is, it has an affinity towards the eye, and there is a need for study to see whether it is associated with glaucoma. So West Nile virus is not seen in our place, but anterior uveitis is also associated with that. Hepatitis virus is very rare in causing glaucoma, but there have been case reports by all hepatitis A, B, and C causing glaucoma. And now Zika virus has produced a Zika virus syndrome, with most dramatic manifestation is microcephaly. Congenital glaucoma is associated with Zika virus infection. And our coronavirus, we have all had anterior uveitis patients who had corona. And as we all know, sadly, actually ophthalmologist first reported about coronavirus, some strange virus, while he was treating a glaucoma patient, and sadly he lost his life. I mean, the ophthalmologist lost his life. So my take-home message is timely identification of the infectious etiology is crucial for prioritizing and managing the disease. Therapies aims at inhibiting or fine-tuning intraocular inflammation and inhibiting specific immune cell infiltration could be the next generation choice of treatment for managing virus-induced ocular pathologies. Thank you.
Thank you for the wonderful